I think what struck me most is where the spending is actually spread out across the NHS and what things cost what amount. So for example, we found out that actually a 6-month dental checkup only cost £17.50. And that's something that people might have thought they couldn't afford to pay for, but in actual fact, because of the cost of it, we thought actually it was quite reasonable that people would be able to pay for that.
There was one which was the ambulance service picking up patients from their home and taking them to a planned appointment, which I thought was incredibly high, and I didn't appreciate how much that cost. And the other one I think was the accident and emergency visit, which I think was £111. And I know I feel that a lot of people use that not in an economic way.
I had no idea that some of them were so expensive and some of them were less than I thought they were going to be. And people really need to know how much charges are, I think, in order to value them.
I suppose I'm beginning to realise that the number of people in work, for example, impacts on the amount of money that the NHS could possibly have, which means it's a much bigger question than how to fund the NHS.
No, because I've come across the figure before. Neither was I shocked about the tenfold increase, because it's only reasonable that that's going to happen with an increasing population and a population that exists in the medical world that's more sophisticated and is treating people better. All treatment costs. So no, I wasn't shocked, and I wouldn't be shocked if people were proposing that increased, because it's actually not about should we tax more, it's about making choices about how we spend the money that we are already being taxed on.
If anything, even though I know 87 billion is a lot, I thought it'd be more than 8% of the GDP, because if that's keeping, the whole country healthy, or well, not healthy, or at least looking after them, I think 8% is a small price to pay.
We did actually, on the most part, agree what should be spent, what should be free in the NHS and what shouldn't be. We do believe physical health is important, as well as mental and emotional, all that. But yes, there were definitely things we thought shouldn't be free. But we did definitely care about the elderly. All of us agreed on that we should pay for the elderly. And we believed that more money should be spent on education, because if people were educated about food, nutrition, exercise, we wouldn't actually have as many health problems as we do have.